Hi, this is Dr. Rupal Lakshman, root canal specialist and aesthetic dentist. Today we will be talking about need for an extraction or simply need for pulling out a tooth. Now, why you want to pull out a tooth? Actually, there are many reasons. Before that, you should understand how the tooth is situated in your mouth. The tooth that is seen in your mouth is just the 1/3 of your actual tooth. Rest 2/3 is inside your gums and bone. Now we list some of the main reason to pull out a tooth. Few reasons are like this. Usually this impacted tooth really impacted inside the bone, it doesn't harm. But the impacted tooth is infected or it hits your adjacent tooth and harms your adjacent tooth, that is a good tooth, then we have to remove that impacted tooth. Normally this impacted tooth means the tooth inside the bone. So actually when the tooth is inside the bone and doesn't harm your surrounding tissues, like it doesn't harm your gums, or if it doesn't harm your adjacent bone or adjacent tooth, then it's okay to keep that impacted tooth as it is. But if that impacted tooth is impinging your adjacent tooth and trying to harm your adjacent tooth, then you have to remove your impacted tooth. So these are usually the common reasons to pull out a tooth. Even this dental caries which extends into the enamel and dentine, these type of dental caries can be restored. And even if the dental caries involves the vital structures like nerves and vessels inside the tooth, those kind of dental caries or those kind of the problems can be solved by a root canal treatment. And if this option doesn't work, there is no other treatment option to save your natural tooth, then only you should consider to extract that tooth. When this gum disease is in a starting stage, normal scaling will be enough or normal cleaning is just needed. But in severe case, like severe mobility, and that is severe bone loss, we cannot save this tooth. So we have no other option, we have to pull it out. Now there is fracture. Again, coming to fracture, small fractures we can easily restore with tooth colored filling materials. And if the fracture extends to pulp, as I just told about this dental caries, if it extends to the pulp, we can do a root canal. But if it extends to the root and the tooth itself splits by two, then there is no other go. We have to do an extraction for the same. So these are the main reasons for a tooth extraction.